Good morning, afternoon, and evening to all those attending today. Welcome to today's Supercharge webinar. Today, we're going to be talking about patient adherence and how to improve it with digital tools. My name is Matt Dunn, and I lead innovation projects here in our UK office, and I'll be hosting today's event. If you haven't heard of Supercharge, we're a digital product agency in Europe and North America. We have 14 years experience where we've been designing and building highly technical platforms and apps across complex industries like healthcare. And to do this, we use a mix of behavioral science, data, and our competence in AI to create products that have real lasting impact. Today, we're going to be focusing on supporting adherence. So many studies show that having an accurate diagnosis and a well-crafted treatment plan is in itself not really enough. The road to recovery requires active participation from patients. So whether that involves adhering to specific medication, modifying their diet, or using a medical device as part of their treatment. In 2024, the average person engages with the digital world for 6 hours and 58 minutes every day, and that number continues to rise each year. Digital tools such as mobile apps supporting the patient journey or connected platforms are an obvious choice for helping patients with adherence. Today, we're going to dive into the opportunities presented by digital adherence support. And we're lucky to have a fantastic lineup of guests from various areas within the healthcare innovation space with us. So we have a deep dive with Job van Boven, a short talk on increasing adherence with digital tools by Bence Lukacs, and then a panel focused on how to get adherence solutions right. You can interact and ask questions with our Q&A functionality. It should be at the bottom of your screen. Please name the person to which your question is directed. If we run out of time to answer all the questions at the end, we'll follow up by email. So first up, we've got our deep dive interview with Job van Boven, interviewed by Bence. Job is founding director of the Medication Adherence Expertise Center of the Northern Netherlands and chair of the European Network to Advance Best Practices in Technology on Medication Adherence Cost Action. If that wasn't impressive enough, he's also an associate professor at UMCG. As a pharmacist with a PhD in health economics, he leads the multidisciplinary clinical research group that focuses on cost-effective optimization of patients' medication use and adherence. He's particularly interested in bringing digital innovations from prototype phase to practice. And he's joined by Supercharge's very own chief strategist, Bence. Bence has been building digital solutions for over a decade now and has a particular interest in scaling personalized healthcare through digitalization. So without further ado, please welcome Bence and Job.
Hi, everyone. I'm Bence. As Matt has already introduced Job and his impressive background, I will jump right into the interview because we want to cover plenty of ground, so I wouldn't take up more time from that. And anyway, Job has more interesting things to say than I do. So hi, Job. Welcome to our webinar.
Don't underestimate yourself, Bence.
Thank you. Thank you so much for making time for us today. And let's jump right away into the first question. So we had a chat with Job before this interview, and he really opened my eyes to how much simply tracking medication can matter when it comes to adherence and like reacting to adherence data. My mind naturally jumps to digital interventions because maybe those are the more exciting digital products, but it seems like just simply enabling tracking can have a massive positive impact on treatment outcomes. So, Job, could you please explain it a bit to us why digital tools that help with tracking medication have such a massive significance when it comes to managing adherence? How can they affect health outcomes?
Absolutely. And therefore, I think it's good to know the scale of this issue because we have very effective medications available that have been proven effective in clinical trials and approved by regulatory agencies. However, in real world practice, we see that around half of our patients have difficulties taking their medicines. So it's a huge population. The impact and the direct impact is on the patient level as clinical as well as societal on the economic level. So the OECD, for example, in Europe estimates that every year 200,000 people die because of not taking their medicines. And this has also been associated with 120 billion euros in potentially avoided costs due to an excess in hospital admissions. And simply said, it has been a famous quote in the adherence world: a drug's not working in a patient that's not taking it. That's the most simple way of saying it. However, how we currently manage non-adherence in clinical practice is the most practiced way is asking the patient, simply saying, "Are you taking your medicines?" as a typical question could be. And this is very much overestimating true adherence. Patients tend to give you a social desirable answer or are overestimating themselves, and that's where digital can really make a difference. It gives you like spot on, very objective and granular data on actual intake, which is very much more useful for clinicians to also act upon, because and that's important. Other advantage of this type of data is that with this data, you can actively adjust your treatment the right way, because the current reflex is when a drug's not working clinically, the reflex of a doctor is increase the dose or add more medicines. And this will come at the expense of more side effects, more economic impact for the society, and an extra burden on the patient. So digital in that way could really avoid this and prompt us as clinicians to, instead of increasing doses, use behavioral techniques to impact adherence, such as motivational interviewing, shared decision making, and so forth. We applied this, for example, in a clinical trial in patients with asthma, where we used a digital spacer to monitor the adherence to the patient's inhaler and monitor them for 1 month, discussed based on this digital data what they were doing over the last 30 days, give them personalized feedback, and the next month we monitored again, and we noticed an over 1/3 increase in the way they were taking their medicines, much better. And both patients loved it as well as our nurses. They love to finally be able to give a personalized feedback and just saying, make sure to take your medicine. So I hope this illustrates a little bit the potential that digital could have here.
Yeah, that's very exciting. And whenever I think we talk about data-driven healthcare, we usually think of extremely complicated schemes, and it can be as simple as the doctor or the nurse knowing that, are you honest about your adherence or are you not, and then just selecting the next best action based on that. So that's sometimes the small things can make a huge difference. So basically enhancing the work of practitioners, and through that affecting adherence. That will be a big theme today, as I had a previous conversation also with our panelists, that seems to be the way to go about it. So do you feel that really impactful digital adherence solutions, do they always need to involve the doctors?
Not always, I would say, but I'm a big fan of hybrid solutions, so that have a digital component on one hand to directly give feedback to the patient, and on the other hand, use that data in the interplay between a clinician's feedback and what the patient is actually doing, in order to make the follow-up treatment as efficient and correct as possible. So definitely, like sending reminders could be directly done between the patient and an app or tracking device. But you need to know first the actual intake pattern. Make sure you characterize also when there are gaps in treatment, what's behind this. So kind of behavior or phenotyping. And based on that, you should give a personalized solution.
And what's your experience? How clinicians feel about these digital tools entering into their practice? Are they like, what innovators should pay attention to when they think about the clinician and involving them in the pathway?
It's mixed, I would say, currently, and also depending, of course, on the experience the physicians might have with it. Also, healthcare is quite a conservative world, so we first want to see, is it reliable? Has it been shown to be effective? But most importantly, also for this type of tools, is that they are not increasing the burden for the physician. So typically, if you just ask, are you taking your pills? This is 2 seconds. However, if you want to together look at data of actual intake and have a little more personalized conversation about this will take more time. So if you develop these type of digital solutions, you have to make sure on the one hand they integrate in the electronic healthcare system that doctors are used to work with. So they don't want 10 different apps that they should be aware of that all of their patients could be using. They want one single system, or they can be different tools, but they should at least integrate into the common management system. And you have to make sure that there's no additional or not too much additional time burden on when acting on the type of data that this device is giving you. The other thing is, of course, proper reimbursement for this for the device, and this is both on the patient side, but could also be on the doctor side.
Mm-hmm. That makes sense, and this is a recurring theme. Like on our previous webinar, this was also something very strongly highlighted. Like if you don't think about the clinician experience and the clinician expectations, like especially the time that they need to spend with a tool, then probably we will see very low adaptation numbers. So that's an important takeaway. Just to kind of round this story up, can we talk a bit about the patient-facing like digital interventions that we can use to increase adherence? What kind of advice do you have there for innovators? Like what are the pitfalls? What are the opportunities?
Yeah, I would say typically the low-hanging fruit would, of course, be daily feedback, only sending when needed. So many patients still like to get a reminder when they're not taking the medicine. So reminders could perfectly be done by usual means. The other thing is additional information, because what we often see in our hospital where I'm working is many patients tend to get so much information at our hospital site, and the moment they walk out of the door, at least half of the information they have forgotten. So the app could also be used to educate the patient a bit on the importance, for example, on the regimen, everything related to good intake of their medicine, potential side effects they can expect, but maybe also how they can avoid these type of side effects. In case of complex administration routes, maybe incorporate small movies of how to take the drug. If it's, for example, injecting or inhaling, which can be quite challenging technically as well. So there's definitely a lot of direct patient feedback features that could be integrated, but also make sure that if a patient is using multiple medicines, that you don't need an app for every single medicine, so that it's more like a platform to incorporate multiple drugs inside one single patient-facing app. I think that's also very important for patient engagement, and really make sure the messages are personalized and based on actual behavior of the patient and not standardized reminders. In case a patient is, for example, afraid of side effects, a reminder is not going to work. So you have to dive into not only what's the patient doing, what are we observing, but also try to understand what's behind that, to dive a little bit into that behavior behind the not taking the medicine, and based on that behavior, provide the solution. And this way you can keep your patient engaged with the app and the intake.
Thank you, Job. That was a great summary. Just to make sure I got the right takeaways. So it's the notification to combat forgetfulness. There is the personalization angle, and there is the educational angle to it. So actually, we'll hear a lot about these topics from Bence in the next presentation. So I think that's a great way to segue into that. Honestly, I could spend the entire day asking questions from your Job. It's always so it's always so interesting connecting these two words. So the people who are actually building products more on the builder side, and the researcher and the clinician side. And if we don't build up this shared understanding, then solutions won't succeed. So I love this conversation.
That's my final recommendation for technology developers. Really, from the beginning onwards, use the knowledge of patients and healthcare professionals in your development. So really aim for co-creation of your solution, because else it will not be fit for purpose.
That's exactly why we invited you here today. And thank you so much for sharing your knowledge with us. And with that, I hand back the word to Matt. Thank you very much, Job.
You're welcome. Thank you.
All right. Thanks both, Balázs and Job there for that. I certainly know about some experiences of giving fluffy answers to my GP about adherence, which I guess is much harder to do via a tech platform. And another good point there about using doctors' workflow and not adding to it, rather build around it and use their expertise too. So as Balázs mentioned, we're going to hear a short talk about the digital side of things and a digital perspective. Bence Lukacs is both a cognitive psychologist and the product strategy team lead here at Supercharge. Bence has got a great deal of knowledge about why people's minds work the way they do. He likes to apply this knowledge to every product he touches, and he's led several digital solutions over the last, I think, 5 to 7 years or so, focusing on treatment adherence that successfully supported users in incorporating a behavioral change that's actually led to a better health outcome. So he's a great man to learn from with both lived and learned experiences. So Bence, the stage is yours.
Okay, thank you, Matt. Thanks for the introduction. And okay, works. All right. Okay, so hi, everybody. I'm going to talk about how to boost patient adherence with behavior science powered digital aids. So first I will cover why is it absolutely crucial problem, why adherence is absolutely a crucial problem in healthcare, and why is it so hard to actually solve it. You've also mentioned some of the aspects already. And then I will show you an approach of combining behavior science and digital tech solutions to tackle this problem, along with a couple of inspiring examples. So let's get into that. So patient adherence is a sort of Achilles heel of treatment plans. And this is because the success of health interventions largely depend on the patient's actions. So whether they take the medication prescribed, whether they follow the therapy instructions, whether they use a medical device that they are supposed to use, like an asthma inhaler or glucose monitoring device or whatever other device. And we can actually, so I'm going to use adherence in that broader sense. And adherence rate of patients, as research shows, and also Job already mentioned that are around 50%. This is the average for chronic diseases. So you can expect like 1 of every 2 patients not following through the treatment. And also 50% of treatment failures can be linked to poor adherence of patients. And these numbers, of course, vary from patient group to diseases, but generally, poor adherence is a problem in every field of healthcare. So why is it the case? Turns out that being a good patient is not that easy. It's actually quite hard. And for that, we can imagine a patient as an example who has hypertension and needs to take meds on a daily basis. And there can be a lot of reasons why this patient skips on his meds. Some of the reasons could be intentional. This is like intentional non-adherence. It can be that the patient doesn't feel any short-term symptoms, so he might think that he doesn't really need that meds that much. Or it can be the fear of side effects or emotional reasons and a lot of other intentional reasons. And on the other side, there are non-intentional non-adherence. It can be simple forgetfulness. It can also be that the patient needs to take a lot of medicine, or the treatment plan is quite complex. And it requires a lot of cognitive effort from the patient to remember everything and keep up with the schedule and keep up with the med supplies and so on. So we can say that non-adherence is really a result of this complex combination of underlying behavioral, motivational, and cognitive factors. So there are a lot of kinds of digital interventions that try to tackle this. And research shows kind of mixed results in that. But to be fair, of course, digital interventions are also not just one kind. There are many different kinds, and it's all about the details. So let's break it down into some of the types, the major types. So there are these application reminders with smartphone, with SMS and so on. And they tend to be only effective at the very beginning because people start to ignore those reminders quite quickly. And I think that one problem with this approach is that it only focuses on this forgetfulness aspect. There are also devices, these smart pill dispensers, usually connected to a mobile app. And again, they, I think, only mainly focus on this forgetfulness aspect too. And it's also a little bit of an investment from the patient. There are these telehealth remote monitoring solutions when the healthcare provider can remotely monitor, often with a video call, how the patient is doing, whether it's taking the meds or not. And I think these could be good solutions, but it requires a lot of time and effort from the healthcare provider. I think it's less scalable in that sense. And also there are these hybrid digital and human coaching solutions, which according to some of the research, they are promising. But I will not focus on these now. I will leave it to other guests, and I will just focus on the mainly digital solutions. So the question I want to try to answer is how to build digital interventions that are both effective and scalable and address all of those challenges that we were talking about. And our answer to this problem is this behavior design approach that we advocate here at Supercharge. And it is about first understanding what drives or inhibits the behavior of a patient, and then find the right tools and methods in behavior science and combine it with the tech tools and opportunities to come up with effective digital interventions. So how does it work? I want to show you a simple but kind of powerful model that describes what drives or inhibits the actions of a patient. And it is called the FOG behavior model. And according to it, there are 3 factors that determine if a behavior, like taking a meds or following a therapy, takes place or doesn't take place. The first one is the ability of the person to do it. The second one is the motivation of the person. And the third one is whether there are adequate triggers to kick in this process. Now, motivation and ability are inversely related. So the easier it is something to do, the less motivation you need to do it. And if something is hard to do, you need a lot of motivation to do it. And behavior will happen if you are above this action line and you get a sufficient trigger. So our job as behavior designers, when we design these interventions, is really to find solutions to move the patient above the action line, either by increasing their ability, by reducing the physical and cognitive effort, and by increasing their motivation with education and giving feedback on the progress and so on, and providing the right triggers. So let's see it through a couple of examples. I actually brought here just 2 examples, but you can read more examples that we collected in our white paper that you can download from our Supercharge blog. So the first example is the Habita mobile application. It is created for patients with hypertension and heart disease to help them build their medication routines. And this solution is really focusing, or the example I want to highlight the good trigger aspect. So this app approach is, instead of just sending those, medication reminders that we know can get ignored very soon, the approach this app takes is what it's called habit stacking, when you link the behavior, in this case, the medication intake, to an existing routine of the patient, like whether the patient takes a morning coffee, then we can link this behavior to taking the pills. So over time, taking the morning coffee or brushing your teeth could be a trigger, a natural trigger to take your meds as well. And the app also focuses on other aspects, making it easier to follow your schedule and manage your med supplies. And also it boosts the patient's motivation with gamification, positive feedback, and a lot of education. So the other example I have is an example of how tech solution can simplify the behavior and therefore help with adherence. And the company is in the business of this urinalysis kind of thing. So treatment adherence is not only important for, or adherence is not only important for treatment, but also for kind of screening and monitoring the patients. And we all know that urine tests are a good way to have a picture about the body functions, but it also takes a lot of time and effort to go to a lab to test the urine. And therefore, if we draw or chart, we can say that a lot of people will be below the action line and won't go to these screenings. So therefore, this company, Olive Diagnostics, created this solution that is a smart toilet device that patients can use at home. It can be mounted to any toilet, and it conducts this non-invasive, fully passive automated analysis of the urine. So every time the patient goes to the toilet, it can be used basically automatically. So therefore, putting the patient above the action line. And it also comes with this companion apps, and seeing your results can be really a good way to prompt the user to take the right actions, whether to book an appointment with the doctor or change their diet or take some actions required. And it's also a good way to boost the motivation by education and talking about that topic as well. So these were just a couple of examples. You can read more examples in our white paper. And to sum it up, I really think that if digital interventions are rooted in this behavior science approach, they can be much more successfully used to address non-adherence. And I think that interventions must really focus on all of these three big aspects of the ability, the motivation, and the triggers at the same time. And also we could see that tech solutions can help a lot in simplifying the actions and also nudging users to stick with their health plans. And as like final thoughts, I would also like to call your attention on to keep an eye on AI as well, as we think that it's going to play a much bigger role in that as well. We have seen, and also Job mentioned these health tracking approaches where, like the smart toilet device, where we can collect a lot of data from the patients that can be shared with the doctor. And also AI could be used to analyze and enhance the capabilities of the doctor to come up with improved treatment plans. And we think that AI could also be used for behavioral coaching to actually help patients implement the right actions with motivational messaging, with providing the right nudges, and so on. So that was it. You can read more in our paper, and thank you very much. And now I hand it back to Matt.
Thanks for that, Bence. As always, great talk. With any digital product as well, execution is everything, but it seems especially true here. You need to have a great product with a great strategy surrounding it if you're actually going to have a meaningful effect on the behavioral change. So next up, we've got our panel session. So we're going to discuss how to actually get these solutions right. So before we do that, we'd love to get a little bit interactive. So we're going to ask you some questions with a poll. So this is because we'd love to learn about our collective experiences with digital adherence aids. And because it's a new field, we'd love to understand what experiences you've had personally. So the poll is now open, should pop up on your screen now. The questions are, have you ever had challenges adhering to a treatment? Have you ever found and used digital tools to support your own adherence? And have you ever been recommended digital tools by a clinician to support your adherence to treatment plans? While you're thinking about those answers, let me introduce today's panel lineup. Today, we've got an impressive cohort of people, starting with Dr. Anna Mandeville. Anna is a consultant clinical psychologist with over 20 years of NHS experience, specializing in physical and mental health. Additionally, she holds the distinction of being a Health Foundation Fellow and an honorary lecturer at University College London. Currently, she is serving as VP of Clinical at Koa Health, where she is working on reinventing how mental health care is delivered from prevention to treatments. Available to more than 3 million users worldwide, Koa Health addresses the full continuum of mental health needs. Their Koa Care 360 platform provides comprehensive mental health care through a hybrid model. Meanwhile, their Koa Foundation application offers self-service access to their daily mental health support solutions. Additionally, we've got Axel Sylvan, who's the co-founder of MSK.ai and the My Recovery platform, which aims to transform care delivery in the musculoskeletal domain. Axel is a trained surgeon, and he is leveraging his clinical background and enthusiasm for digital innovation to help reinvent both the clinical and patient experience. MSK.ai consults hospitals and entire regions to create more optimal, digitally enabled musculoskeletal pathways. Their digital solution, the My Recovery platform, allows healthcare professionals to provide customized companion apps for each patient's treatment journey. The goal of My Recovery isn't just to enhance the patient experience, but it also aims to improve the clinical outcomes and reduce healthcare costs. And last but not least, we have Vivien Ostinelli, who's the head of design at 9am Health, which is an end-to-end virtual cardiometabolic clinic operating in the US. They champion flexible remote care, simplifying the life for patients with diabetes and other cardiometabolic conditions. Vivien spearheads projects that blends innovation with user-centric design principles. Focusing on diagnostics and diabetes since 2018, he strives to craft solutions that not only solve problems, but do so in a user-friendly way and visually appealing as well. So many exciting discussions to come. Balázs, it's over to you.
And I'm back, and we can also see the poll results. So before we dive into the discussion, just let's have a look at the poll. It seems like 66% of our participants today feel like they had challenges adhering to a treatment. So that seems like a pretty high number. And yeah, as we know, self-reporting usually tends to overestimate adherent behavior. So it might be even higher than that. So seems like this is a massive issue, even for people who are actively engaged in thinking about healthcare. Probably the results are way better than for the general public. Have you ever found and used digital tools to support your own adherence? 47% said yes. I'm quite happy to say that, because that means that these solutions are more ubiquitous than I thought. So almost half of our participants who are here today have used a tool, digital tool, to help with adherence. And have you ever been recommended digital tools by a clinician to support your adherence? Only 17% answered yes. So it feels like even though these tools are around and people do use them, clinicians don't actively incorporate them yet into the pathways. Actually, that will be something that our guests can say a few words about. And with that, let's jump into the panel discussion. I'm honored that I can facilitate it today, because we have such exciting guests. While Job gave us a research and clinician angle, All of our three panelists are busy building products, not necessarily themselves, but being parts of teams that build products. And actually, based on my initial discussion before the panel, my feeling is that they are not just building products, they are rather building ecosystems of connected services and products. And I think that will be a recurring theme in this panel, that if you want to have real impact in healthcare, you have to come up with pretty complex solutions. It's rare that a simple app will just cut it. Although two of them also have medical background, they are today here as like practical innovators and product thinkers. As you will see, all the three companies offer very holistic solutions, which include patient and clinician-facing digital elements. And I feel that patient adherence is like a really critical aspect for their success. Just very quickly, I wanted to highlight how they are connected to our adherence theme today. So let's take COA. Therapy, mental health therapy, only works with a committed participant who actively works to improve their mental well-being. They need to be an active participant. This commitment starts with just showing up for sessions, but then continues with all the self-care and learning that's done in between sessions. And then there is 9 a.m. health. Cardiometabolic conditions often require lifelong treatment. So on one side, you have to administer the treatment, take the medication. There can be regular measurements that one needs to perform. And that's not all. Unfortunately, with these conditions, you often have to adhere to pretty strict lifestyle choices, like the kind of food that you eat. And that requires lots of self-control and strict adherence. And finally, we have MSK.ai, the complete and kind of complication-free recovery from surgeries largely depend on the patient following strictly the prescribed post-surgery protocols, which often, and yeah, obviously anything that can help them do that will be very beneficial for their recovery. So adherence seems to be a very important objective for all the three companies. And with that, let's jump into the questions. So hi, Anna, Axel, Vivien. It's great to have you here with us.
Hi, Balázs. It's great to be here.
Hi.
Hi.
Thank you. So first, I will turn to Axel and address the first question to him. What is your experience with digital tools in promoting adherence? What are the keys to creating successful digital support tools? What did work for MSK.ai? What didn't work? What were the learnings?
Well, I don't know if we have time to go through the full list of everything that's worked and didn't work. Not everything has worked, but enough has worked to get us where we are. And I think what's helped is looking at the keys to digital tools as sort of bringing it together in kind of the 5 ITIs as a bit of a loose term. So beginning, of course, with safe ITI, first do no harm, and security kind of goes without saying. But from that foundation, you can then build on with usability, clarity, and a bit of a stretch perhaps, but problem-solving ability. And for adherence, the final 2 are really the key. So clarity and problem-solving. And really what that means is understanding the key stakeholders, understanding the problems that you're going to be part of solving with your digital solution. And as that comes together, making it very clear who you are, the voice of the app, where the information is coming from, and how it will help the end user. And in that case, as with many tools, I'm sure, that means both patients, as in the end users of the My Recovery app, but also the patient's healthcare team who may be engaging directly with the patient via our web dashboard. And so trust is a key factor from that. It's part of any relationship. And really, for adherence to be successful, what we're dealing with is trying to establish a relationship. So it's about developing that trust, having the clarity for the end user about where the information is coming from. And how we've gone about doing that, there's many different ways, but how we've gone about doing that is really focusing on making sure that the patient experience within the app mimics and reminds them of the patient experience out there in the real world. So down to like branding, colors, images, and even in many cases, patients will see their own healthcare team popping up in the sort of talking head videos that follow the patient through at each stage. So but it's very clear, where's the information coming from, who's involved, how can it help me as a patient? And that helps both sort of the buy-in of the end user as well as their healthcare team, the clinicians.
Thank you. That actually, you mentioned that in the previous chat as well, and this was a very exciting one for me. Something I just wouldn't have thought of, like creating this coherent experience.
Yeah, well, and I think as we touched on, and I think with Bence as well, talking about how do you do something like this but in a scalable way, because in the ideal world, and maybe with AI we can get there, everyone would have an uber personalized experience, but ultimately now to make it work, we need to find a balance between the uber personalized and the scalable and the safe and the workable.
Absolutely, that makes sense. Anna, could you also tell us a bit about your experience with supporting adherence at COA?
Yeah, it's a pleasure. I was going to just talk a little bit about how adherence is really important for therapists, actually, because if we're talking about mental health therapies, which is what COA specializes in, when I was trained, we kind of got trained on regular courses. We might have been given a booklet, then we're perhaps supervised by people with more or less skill. And one of the difficulties is that our skills can kind of fade, or we might not get the support to keep those skills up. And one of the things that we have at COA is a range of digital tools which work in a hybrid way. The clinician still sees the patient for sessions on a weekly basis, but also they have a full platform which the therapist can use and the patient can use. And this platform structures the treatment. So although the clinicians are still using their skills and selecting different modules, it really helps the therapist to adhere to what we know is an evidence-based treatment framework. So they're not kind of cutting corners and not missing pieces out. And it's very, very convenient because the platform both has all the tools that the therapists want to use and all the tools that the users want to use. So that kind of structure is something really, I would have kind of dreamed of when I was a trainee. I wouldn't have even thought it was possible. But this is the fantastic thing about tech, is that, when we can use it in the service of the therapy, it becomes a really fantastic tool for both sides, and it helps the therapist adhere to what is the evidence-based treatment protocol.
Thank you, Anna. That's also a very exciting take on this. And I think when we talk about adherence and digital tools, at least my mind usually goes to patient-facing interventions and enabling tracking, like mobile applications. And I find it very exciting how both you and Axel kind of highlighted that connecting clinicians into the story, enabling clinicians, digitally enabling them, can have a similarly strong impact like creating tools for the patients. So I think that's a direction I didn't expect this conversation to take before we started to set up the panel. To round up the picture, let's hear from Vivien as well. And in their case, 9am Health has its own clinicians and other healthcare experts who work within the virtual clinic. So I guess there were learnings about staff enablement, enabling the clinicians working for 9am Health with digital tools, and how can that have like a positive impact on patient adherence. So Vivien, please tell us a bit about that.
Sure, thank you. So to begin with, there's two things I would like to point out in this question. To begin with, the direct messaging feature is quite important in our business and has shown really very positive outcomes, allowing asynchronous care versus calls or in-person appointments. This is something that is very convenient And that really allows a secure and convenient communication channel. Without a direct messaging feature, it's difficult to make asynchronous exchanges because of the nature of the information that cannot be shared via email or SMS, etc. And in that regard, developing our own app has been definitely helpful in that regard. Using push notifications really allows to reduce the latency between the care team and the patient. And in our case, the relationship between the care team and the members is very important. So having a smooth communication, being reactive, helps to build stronger relationship, therefore impacts the adherence on the long run. So that is something that was one of our very first feature, and that has evolved along the way. And the second very strong tool and digital enablement that we have and keep improving is our own EMR, so also our own patient management platform, which really allows us to create tailored solutions for specific workflows, specific integrations with other services. We evolve in a very complex environment, so we need to connect with insurances, with labs, etc. So there's really a lot of partners that we need to work with. And we need to ease the job to be done for our care team, but also for our users. So by having our proprietary tool really allows us to improve, integrate, reduce the overheads that, for example, the care team would have to do, so reporting, doing some manual work, and increase the time available for them to take care of our patients. So that could be what I could mention to add on that.
Yeah, it seems to me from all the answers that basically helping doctors and nurses and administrators with digital tools to just provide better care, have more time for what matters, and have a more structured workday helps in adherence, because it's easier to adhere a well-structured and well-delivered care plan. Okay, that brings me to my next question. I think we explored the clinician side, and obviously I would be very interested to hear a bit about the patient-facing tools as well. First, I would like to hear from you, Anna. So COA has two patient-facing tools. That is COA 360, which supports this hybrid delivery of mental health care, and then you have COA Foundations, which, as far as I understand, is a fully patient-facing self-care tool. Can you tell us about how these two applications help patients to adhere to their therapy? What seems to be working for you?
Yeah, we have in our COA Care 360 two levels of stepped care, actually. So the first level is our COA Foundations app, and for example, if you're working with an organisation, this app can be deployed across the whole organisation, and it contains a number of psychoeducational, interactive practice elements one can do around one's mental health, using skills such as CBT-based interventions or acceptance and commitment therapy interventions, mindfulness, positive psychology. And that's really for we have two levels that are kind of subclinical or preventative, which is that level. So anyone in the organization can log in and then use that app in a sort of self-serve manner to really enhance their well-being and teach them about maintaining their own mental health. And we have sort of different ways of promoting adherence in that. Hopefully we make it very fun and educational, so people want to go on the app, and the way we've designed it and presented it enhances that. We also have sort of mini pathways, so we curate a user's experience. So if they want to work on anxiety, we suggest, try the mindfulness bit here, try some challenging the thoughts here, and we kind of build a little pathway that they can explore. So that's kind of positive, lots of positive reinforcements and small quizzes and practices as they go along. So yeah, really that's the kind of self-care level. And then what we do is within the COA Foundations app, we have a wellbeing assessment. So every couple of weeks, users are encouraged to complete the wellbeing assessment. And this has got a number of short standardized tools that screen for the possibility of clinical levels of anxiety or clinical levels of depression. And if the user scores above, then they are invited to do a longer questionnaire and actually see a therapist to talk about whether they might need to step up to some of our digital therapies or teletherapy. I mean, they might not once they've had that conversation with a clinician, in which case if they decide, okay, just try foundations for a bit more, they can do that, or otherwise they can go into one of our treatment programs. And then when the treatment program's finished, hopefully the therapist can help them to identify what they can do also to maintain their mental health as they step down from the treatment program. So I guess what we have in there is quite a lot of hybrid ways of working. So once they get to the therapist, they'll get lots of encouragement. They can step up to the right level of care, and they can step down to the right level of care. So I think when we deploy it together, I think all in all, it provides, you know, a nice kind of continuous method of deploying the right care at the right time for people. So that's been our experience. We're just working with a bank in America and had some really good feedback from people saying that it's a, you know, really great comprehensive solution, and that they've enjoyed using it and found it easy once all those levels are integrated. Does that answer your question?
Yeah, I think absolutely. And I feel that if you think back of the model that Bence presented about ability and motivation, I feel that you are work like exactly as Bence suggested, you are working both sides pretty well. Like there are motivational elements, there are elements which simply make it easier for you to participate in the program. There are elements which make it more personalized, like more fit to your needs, which again probably makes it easier to stay part. It's also more motivating. It's always more motivating to be part of something that feels tailored to my needs. So that seems pretty holistic.
Yeah. And talking about, we just the co-design element as well, we just got some user feedback, and that the users were also saying that they would like to see more of a kind of a community element, because they were recommending the tool to each other in the workplace, but there was not an easy way to do that, only by sort of going up to someone and tapping them on the shoulder. So we're now getting feedback about what users would like to design back in, and as we said at the beginning, it's all of those things, isn't it? So quite a complex solution that you're sort of tweaking and nudging and iterating to find out what's actually going to work in the field.
Yeah, I don't expect to hear one silver bullet solution here. Thank you, and with that, let's turn to Vivien. So we had a chat before this panel, and it really struck me to hear how much it's at the core of 9 AM has to increase access and remove barriers from the way of patients to participate in the care that you provide. And yeah, that's, if I'm thinking of Bence's model, that's all about the ability, increasing the ability, removing barriers. Could you tell us a bit about what 9 AM has specifically done in that field to increase access?
Sure. So indeed, living with a chronic condition is pretty heavy, right? So there's tons of decision making that comes with it, or mental burden, or difficulties that patients or members have to face every day. So it is very important for us to remove those barriers, as you mentioned. First of all, we are in our members' pocket. We're just a fingertip away from their endocrinologist, from their dietitian, coach, patient advocate, pharmacist, etc. So having all this in one place is really helpful, because it takes away a lot of hassle from a patient to get answers and to get support for their chronic condition. Second of all, what is very important is that problems are approached with a design thinking approach, right? So we are to be user-centered. You need to listen, so you learn a lot, you improve, you break, and you repeat. You adjust to your member struggle. As it was just said, like listening to what users have to say, collecting feedback on top of collecting data is very important to learn and fit better, answer better a user problem. So for example, there's a couple of things that we put in place, such as to-do lists, reminders, as we mentioned earlier, is very important. Basically also putting together some personalized education plans, etc. So those are things that considering all together helps to really address problems in a way that can help our users. And last but not least is that we take away the burden of our members so they can really focus on living. So by automating processes with advanced integrations within the complex environment, as I mentioned earlier, is really simplifying the whole experience of our members. And that makes it just simpler, less back and forth for them, less complications. So for example, things like insurance navigation is very important to help them accessing it and getting their medication taken care of financially, because there's a lot of people that do not take medications because they just simply can't afford it. So that is one point. Using device networks, very interesting as well for remote device remote monitoring, sorry, is very important. There are solutions that, for example, are cellular connected that can be done very easily. So no need to be tech savvy to pair a device, etc. Data is sent directly to the care team. Having access to the right medication partners, so like pharmacies, being able to offer retail pharmacy or mail order pharmacies for those who want to receive their medication and refills at home. Having integrated partnership with laboratory that can report back results without having the patient to report back. And in general, having technology enablement partners that can really simplify the whole technical approach and the very complex things that needs to be done by what is caused by their chronic disease, basically.
Thank you, Vivien. Well, I guess anyone who expected like a simple answer that this is the 1, 2, 3 of increasing adherence with digital tools is probably pretty disappointed by the whole conversation so far. It's a very complex topic, and it feels to me that you're like increasing adherence is something that you build right into the DNA of your product and service. It means many things, and it needs continuous iteration, learning based on the data, and probably what works for one tool and one domain doesn't work for others. So I think that's already a very important learning. So if someone hopes that just by sending reminders they can tackle the adherence issue, they will be quite disappointed by seeing the results. We will run like just a few minutes over time, I promise, but I really would like to hear from Axel. So MSK.ai has a patient-facing application, My Recovery. How does that one facilitate adherence?
Yeah, sure. I'll try keep it quick, but you're quite right. It is hard, but what's also nice is that there's no big secrets in the field. You know, it's complicated, but we like to say that MSK.ai, it's not rocket surgery. You know, a lot of what we're doing is just delivering the right information at the right time, and that links in a lot to what Dr. Van Boven was saying about, you know, patients either being overwhelmed by information or not getting enough. So just breaking it down, delivering, you know, what they need at that time, and making it very clear to the patient what to expect, what's expected of them, and where is this information coming from, coming back to that thing about clarity. And of course, also from what Dr. Van Boven was saying, and I think Vivien and we've all kind of touched on the idea of like the nudging and the behavioral psychology aspects. They absolutely all play in, and you know, there are no big secrets, but the value, I think, of conversations like this is that it's by learning from different takes on this, different versions, is that you then start to navigate, okay, well, how could this work in my world and in my context? But a key thing is also that, you know, everything happens for a reason. You know, well, in the real world, that might be a bit philosophical, but within an app, you know, you never underestimate the value of just tracking how a little change, you know, changes the experience for the patient and the kind of interactions that you get and the data ultimately that you're getting from your product and filtering on to a healthcare team or whatever it might be. So really, I think from my point of view, it comes back to that, you know, patient first, but the clarity in terms of the interaction around what's expected of them, and where's the information coming from.
Yeah, I can very much relate to that. Like, and with that, we are getting to the closing remarks. Just like 2 weeks ago, I walked out from a hospital in New York. I had a great experience interacting with them. I was not very amazed by the digital tools that they use after, but they gave me a piece of paper that was just a very simple description of what are my next steps. And I don't think I ever had that with that clarity, like big letters, simple things, keep taking this medication, stop taking the other one, get this one in 1 month, go to this website, watch this video. Simple as that, no thinking required on my side, and I was very thankful for it because I needed to fit it into my busy schedule, and this removed the cognitive effort from it. So even sometimes a piece of paper, and if that can be more personalized and delivered in a more modern digital way, that's obviously even better. But yeah, sometimes simple things can help a lot to increase your ability to adhere to a solution. Thank you so much for all our panelists for joining us today. I had one more question in store regarding large language models and AI, but I think we will have to leave that for another occasion. Probably it's worth organizing a whole webinar around that. This is such a hot and exciting and also fairly perplexing topic, how to use AI in healthcare in patient-facing applications. So thank you again for everyone, and I will hand back the mic to Matt for some closing remarks.
Thanks for that, Balázs. And yeah, I'm looking forward to the LLM-based webinar because, yeah, there's lots of applications that we can see and are excited about too. I hope you guys have found that as inspiring as I have. It's really easy to get excited about the things that are happening in this field, and I think there's a lot of opportunity to be had. So go forth with the learnings and build good things. So that wraps up today's event. Very lively discussion. Hopefully lots of takeaways to consider. I'd like to thank our speakers and panelists for sharing their expertise and being willing participants. We're going to follow up with questions that we didn't answer, and we'll share the recording after as well. As Bence mentioned earlier, we just released a white paper on this very topic. It's called A Practical Guide to Boosting Treatment Adherence with Behavioral Science-Powered Digital Aids. There's loads of great examples of digital adherence in action, and it's got quite a lot of breaking down of the frameworks that are used and how you can implement some actionable steps. And you can download that white paper from our website's blog. And finally, from everyone at Supercharge, I'd like to thank you all for joining today. Without you, it doesn't happen, so I appreciate it. I hope you enjoyed the session and found it useful, and hopefully see you at the next event. Thanks.